Today I'm going to apply a conventional synthetic below knee cast. This type of cast is suitable for all indications in and around the ankle. This would include fractures, trauma, orthopedic conditions, and soft tissue injuries. The products required are one-piece Benecast stockinette 7.5 cm, one roll Benecast synthetic undercast padding 15 cm, two rolls Benecast Select polyester casting material 10 cm, and adhesive padding for extra protection over bony prominences. Today I have chosen to use the Benecast Select. However, other suitable products for this application would include the Benecast Fiberglass and the Benecast Advanced Polyester casting material. The choice would depend on the indication and your clinical preference. Position the limb appropriate for the indication and ask your assistant to maintain this throughout the whole procedure. I will start by applying one layer of Benecast stockinette from the tibial tuberosity to the end of the toes, ensuring it is smooth and wrinkle-free throughout. Using the 15 cm Benecast synthetic undercast padding, start to bandage at the proximal aspect with a double layer, working from lateral to medial and covering 50% of the previous turn, ensuring it fits snug to the limb with no ridges or wrinkles, paying particular attention to the heel area, and again apply a double layer at the extremity of the cast. This will provide even close-fitting coverage throughout the limb that will be suitable for all indications. If additional padding is required, use adhesive fleecy web as negative padding where necessary. Today I have put extra protection on the medial and lateral malleolus and at the distal aspect of the cast. Now apply gloves. It is important to wear examination gloves when using a synthetic casting material. This will prevent the resin from damaging your skin. Today I have chosen to use Benecast Select polyester. For a limb of this size, I will use 2 rolls of 10 cm polyester casting material. The setting time can be varied. Several squeezes in the water and a squeeze out of the water will provide a 4 to 5 minute set time, or dip in the water for 1 to 2 seconds and squeeze only out of the water. This will provide a 6 to 7 minute set time. Remove the casting material from the pouch and dip the roll into the bucket using the appropriate dip technique. The water should be at room temperature 22 degrees. Then start to bandage at the proximal aspect of the limb, leaving 1 cm of padding at the end to ensure a soft padding edge, bandaging from lateral to medial, covering 50% of the previous turn. Continue down the leg. Keep the bandage close to the limb and ensure you have perfect conformability throughout. On reaching the extremity of the foot, stop 1 cm from the edge of the padding. This will ensure you have a soft edge. Now work backwards, continuing to cover 50% of the previous turn, using the remainder of the bandage. You will now have 4 layers around the foot and ankle and 2 layers around the calf. Check the extent of the cast, trim if the toes are restricted, and then turn back the stockinette. Trim the stockinette to approximately 2 cm. This will ensure it does not affect the lamination of the cast and will not block the blade of the cast saw during the removal. Now use the second roll of casting material, repeating what you have done with the first. Dipping the roll into the water, squeezing any excess off, and starting at the proximal aspect, working down the limb, covering 50% of the previous turn. And then continue back up the limb. You now have 8 layers around the foot and ankle, and 4 layers on the remainder of the cast, which follows the recommendation of 4 to 6 layers for non-weight bearing and 5 to 8 for a weight bearing cast. depending on functionality and body size. Mould the cast well to the contours of the limb, paying particular attention to the arch of the foot and the ankle. This will laminate the layers, making it a strong cast, and also ensure it is a perfect fit, therefore holding the limb in the correct position. The setting time can be varied depending on the indication and the skill level of the practitioner or nurse. This is between 4 and 7 minutes, as mentioned earlier. At 5 minutes, the cast is just about reaching the green stage. It is now set sufficiently to rest on a pillow. However, you will need to allow 30 minutes for the cast to reach functional strength. Check the cast is not causing constriction and the patient can move all joints that are not encased in the cast. If the patient is weight-bearing, fit a walking shoe. The Benicare post-op is the ideal choice. Please ensure you provide written and verbal cast care instructions for the patient.
Sign up to the Benicare Academy to download a PDF step-by-step application guideline of this tutorial and be the first to watch when we launch new videos. benicaremedical.com/academy. Connect with us on Facebook, Twitter and YouTube to see all our latest products, videos and competitions. If you require more information on our products and training, please visit our website benicaremedical.com.